I'm a geriatrician who's been a geriatrician for a very long time. I see a lot of friends in the audience. Just to share, I had a good many years in actually Ministry of Health. And my job at that time was to predict what was going to happen to Singapore in 2030. It's called the ultimate in crystal ball gazing, where the Singapore government tells you to predict what's going to happen to Singapore in 2030. And 2030 is just around the corner, and we are now have the privilege of being called a super age society. I don't know what that means. I don't know if it's a privilege, but we are going to be super aged. And one of the things that at that time, even as a geriatrician who didn't know anything about vaccinations and about infectious disease and the importance, I know more about dementia. Is that at that time I had a lot of good friends who were ID physicians, some of whom are in the audience here, and they gave me a tutorial and they said, Carol, the first thing you must do is promote vaccinations. So that's one of the things I did. And I wrote tons and tons and reams of papers to justify to the Singapore government why we needed to promote vaccination. And we did. And now we are in 2023, Singapore has launched Healthier SG. And Singapore has also launched the importance of vaccination, of which flu vaccination is one of the key pillars. However, the first thing that I just want to share is that it's been a difficult journey, and for us and for me, the lessons learned is what I'll be sharing today. From the government perspective, also working with private, with people sector, is that the first thing to say is vaccination is everyone. Singapore has a stellar record for baby vaccination. We are like 98% plus for babies, because the moment they're born, we catch them and we vaccinate them. But once they get older, we sort of lose them in the system. So the first thing is to remember that we adopted a whole family approach, and it's as complicated as the ones that I'm showing. So vaccine preventable diseases, good for the old and the young, burden of influenza, vaccine hesitancy, the 5 A's of encouraging vaccine uptake. And so I'll be sharing the 5 A's from my experience on the ground. And actually, just to share with friends in the audience, I'm half Malaysian and half Indonesian. So in 2 weeks' time, I'm flying to Indonesia to see whether we can support and do our program there as well. So vaccine preventable diseases, and obviously during COVID. So what during COVID was, just to share, is that during COVID, when the Singapore government locked our entire nation down, and deservedly so, my vaccine mobile clinic was running. We went out there with N95s, we went out there to vaccinate, we went out there to hold hands, and often we were the only healthcare group that actually was still running, even as the nation was breaking down. But guess what? That was the best time to vaccinate for flu, because the Singapore government basically told everyone, if you don't vaccinate for COVID, you cannot go into the shopping mall and this and that and the other. So what's the best time ever to also promote flu vaccination? Of course, we know Singapore super aged. And the whole thing about immunity, is about disease burden and complications. I'm talking to a group of people, so I'll skip through the first few slides, etc., a little bit faster to talk about chronic disease. The first thing I said, as a geriatrician, the first thing I said is don't be ageist. Don't blame people just because you're 65 or you're gray hair, therefore you need vaccination. Everyone needs vaccination. And the Singapore profile is even the young have diabetes. So the first thing I went out there to say that vaccination is for everyone. Don't say it's just for the old. And unfortunately, this is Singapore. We are the very unhealthy, healthy nation. You know our lovely food, right? So in Singapore, if you throw a stone and you're 60 and above, 1 in 3, 1 in 4 maybe will be hypertension, hyperlipidemia. So we are actually not that healthy. But we are working hard to not be that unhealthy as to need hospitalization. So we accept the fact that the genetics of it, or for whatever reason, we are going to have a lot more diabetes, high blood pressure, and hyperlipidemia, which therefore needs our vaccines. And comorbidity for us is quite high. So in other words, it's 1 person, 3 diseases. Well, we call it the San Gao, the 3 highs. So our population will call it that. They call it the San Gao 3 highs. And increasing comorbidity obviously is an issue, and a lot of Singaporeans do have it, and that's a problem that we are going to face. And so efforts should be made to vaccinate adults. So basically for myself, in addition to whatever I did in Ministry of Health, was to tell the ministers, actually adult vaccination is for adults. Sounds a bit weird, right? Adult vaccination is for adults. Adults, 18 and above, you included. So anyway, so that's what we did. And we started to say that what is adult vaccination? So then you go into all the diseases, and then we talk about influenza, which I'm going to quickly go through. And to say, yes, our figures are not that great compared to some of the rest of the world. I am amazed at Thailand's figures. And what is the current flu uptake for Singapore? Well, the figures vary depending on which government ministry announces it and whose civil servant KPI is related to it. But notwithstanding, the numbers are not as good as they should be. And the global burden of disease is obviously an issue. And we all know that the hospitals are full, everything is full. And I don't think I need to prove to everyone this in this. So therefore, let's talk about to the meat of the matter. What do we do? If we know the science is correct, everyone needs flu vaccine. Yeah, the science is correct. We know that it's international consensus. I don't think we can ever do, I echo my previous speaker, there's no way we can do a head-to-head, shoot normal saline in one population and shoot vaccine in the other and then measure. We're never going to do that. And that was one of the arguments I had with the Ministry of Health, especially. I said, there's no way you're going to do that when they keep saying, show the evidence. So the issue is, if we accept that it is the evidence and we accept that it's a consensus, that we're what we do. So that's when I was halfway in ministry and halfway out. And I said, well, let's do the 5 A's. What are the 5 A's? First, we must raise awareness that the disease exists and that the vaccine is effective. Anti-vaxxers notwithstanding. We must make it available. We must make it accessible. We must make it affordable, and we must audit the number of people who do get vaccinated, number of people who are supposed to get vaccinated, who didn't get vaccinated, because that's a nice KPI to track. Because what isn't tracked isn't measured. What isn't measured isn't done. What isn't measured isn't funded, and therefore not done. So awareness. And for me, we went all the way out there, and I'll explain how we do awareness. Make it available, obviously accessible, affordable, and auditable. So vaccine hesitancy is the delay in acceptance or refusal of vaccination despite availability. And for flu, it's been around for so many years. Yeah, it's a good old vaccine. So it's complex, definitely, varying across time, place, and vaccines, influenced by complacency, convenience, and confidence. So when we did vaccine, we actually didn't bother to educate the doctors so much because we are so busy doing the high blood pressure, diabetes, and all that. So what we did was we educated the people themselves. We mounted a social media campaign and told the people, if you have the sun gao, high blood pressure, diabetes, cholesterol, you need the vaccine. When you go and see your doctor, cardiologist, gastroenterologist, whoever you see, please remind them that you need your vaccine. So we flipped it the other way around. We found that that was more effective. So I actually have what we call vaccine ambassadors, where we train them in the specific lay people. And in Singapore, we have 4 languages and 27 dialects or whatever it is. So we actually have lay people who actually can communicate and actually have more time. My doctors and nurses have no time. We have 5 minutes per patient. Good luck, By the time you convince them to take your high blood pressure medicine, you got no more time. Next patient waiting outside. So what we did was we had lay people who took it upon themselves to be what I call vaccine ambassadors. And they spend half an hour with the patient and just chit-chat. Because especially for elderly, they are lonely. Yeah, they want someone to talk to them, to understand their issues and all that. So we have vaccination ambassadors, we have direct outreach, we have road shows, and we do it opportunistically. So I run a mobile charity community clinic. They come for screening for dementia. After they finish the screening for dementia, the vaccination booth is next door. Then, thank you. Of course, I do things even like goodie bags, which is very common in Asia. You must always give the goodie bag, So even if it's a little bag with just a little pen in it, it's wonderful. So we do all these things to actually do the awareness and to reach out. And then so the vaccination ambassadors help us to do this. And then the availability is obviously supply chain and all that. I had a hell of a problem during at some periods to even get my vaccine supply in, obviously, even for flu. We were running short in the world, so we were sort of chopping, in Asian term it's called chop. So we were chopping thousands of vaccines and just to get our supply to continue, especially during the COVID time. And so that is available. This is my little peapod van. I've changed my van. I've now got a bigger van. I'm trying to figure out what to put on the livery of the van. But we use the van also to raise awareness. And what we do is we actually go to the bottom of the HDB flats. So if you know, in Singapore, 95% of my population is living in government housing. So what we do is my little van will drive up all over the place, and then we'll park right at the bottom, and then we'll say, hello, we are open for business. Mobile clinic. So actually in the earlier days, I actually got a special mobile vaccination clinic license. And then we do everything from cold chain to AEDs in case, of course, if you wave a needle to apaci, she might just heart attack on you just without the vaccine. So we have AED, we have cold chain, we have every single thing. And then we start to pre-register, we do blitzes, and then we vaccinate. And they come down. Of course, then after that, thank you very much for doing vaccination. Please find your little goodie bag. Also can. Yeah, so we give them other stuff or things like that. So we address not the science, but the human psyche. This is good for you. We love you. We bring it to you. And I also basically got funding for it. So it's free, as in free. FOC, $0. So that's where the other part of it comes in, which is affordable. What do you mean by affordable? Well, first thing is the vaccine company that I buy vaccines from has a really hard time from me because I bargain really hard. And I achieve MOQ, minimum quantity bulk order, and then I will bag. So I'm a professional bagger, so I get it at lower price. But what I did was also I figured out that in the end it's affordable not to the clinic, but affordable to the person that I'm giving it to. So I worked out what we call tripartite. Singapore loves the word tripartite, which is three parties coming together. It's a fancy word for three parties coming together. So I got a little bit of government subsidies. I got the company to give me at a cheaper price. Value added price. It's never cheap. Then I also got charity dollars. So I vaccinate 50 and above, $0 copay. I don't even take from your tax or whatever, MediSave or whatever. And then we tell them, and by the way, making it free doesn't mean they will come. So all the other things had to come in. The sayanging, I love you. Granny, love your granny. We're going to do Grandparents' Day in about 2 weeks' time or whatever. So then there are all these things, including goodie bags. Then they came. So I was just telling my people yesterday to analyze our data. What are the repeats? That means every year they come back, because flu is every year, every 6 months. And what are going to be the news? So we're actually auditing our numbers. How is our success rate? Not just for the news, not just for the old ones who come repeatedly, so I call repeat customer equivalent, as well as the new people they are outreaching to, that we are winning the hearts and all that. So that's why it's called affordable. But affordable also, which is why I always tell the pharma companies, don't just try and sell me vaccines, try and help me, because it costs money to outreach and market. Spend a lot of money from the vans, the ambassadors that we have to pay per hour, the administration, the checks and all these things. These all add up to the cost. I am MOH and I'm from MOH and I actually do health finance. So we actually went through this whole thing. Even for disposable of sharps, do we get a big box or a small box, which is cheaper? And all these other things, so that we could make it $0 or we could make it cheap. Yeah. And then, of course, there's the public and the private and the people sector partnerships. And these are the issues that we actually do face. Then there's the auditable part. We audit, and I report to my funders. I report to Singapore government, but I also report to my funders, who are private funders, so that they know they get value for money. So every year I get a renewal. I audit in terms of clinical outcomes. I audit in terms of service. I'm not unhappy. my nurses did not vaccinate and then they get a big bump. So that's also not good. Audit in terms of our cold chain and then the cost of it of all. So that's what actually we are living with now. So actually the final cost is a lot more. But the funny thing is, even if you don't get that much from vaccine subsidy, I got subsidies, or we got support, or my own clinic supports for other things. So it's not about a vaccine program. It's about a senior or a adult preventive health program, of which vaccine is one of the pillars. Then I can pull money from everywhere and then do it together. So that's why it's an interesting concept, but it is the way we have managed to survive. And so that's where we are going for. Final cost and all these other things that we are doing, okay? Public subsidies and all that. But, and this is my favorite slide. I know I'm holding you back for tea, so we'll just be entertaining and short. Yeah, paperwork can kill you, because to get vaccine, and I would like to thank actually Dr. Liu Yixian, Prof. Liu Yixian, who actually helped me because I was struggling with it. And I use media a lot, actually. But, and I work through with other systems to promote it. But let me tell you a funny story. Okay, so I'll end it with this. So Singapore has vaccine subsidies for influenza. Yay! Okay. It's actually, by the time we all throw in everything, including private sector, for me, it's free. So I was happily vaccinating. And it could cover, because with the subsidies, I could give more, right? There's a limited budget. So if the government gave me subsidies, I could do more. So I was vaccinating like thousands, even during COVID. Okay. So I was very happy because we had subsidies. It kept us sustainable and all that. Then somewhere along the way, someone in some ministry division somewhere said, Dr. Carol, government vaccine subsidies for flu is not for mass vaccination. So they cut my subsidy. Then I said, why? Because we are achieving the numbers, right? They said, because it's mass vaccination. The subsidy is not for mass. So coming from Ministry of Health, I said, define mass. Is it 10? Is it 15? Is it 20? Because during COVID, we actually by appointment so that we have social distancing and also that clinics are not crowded. Define mass. Is it 15, 20, or 25? We don't know, but it's mass. Okay. Then they said, then I said, if you don't know, if I have 15, is it okay? Then they said, no. It is also not for mobile clinics. Then I said, but you just passed the Healthcare Services Act that all clinics in Singapore also have a mobile license. And even before that, I had my own license. So I also can. It's a clinic that's giving the vaccination. It's not a nurse wandering around with an esky or something like that. Oh. Then they said, but it is available for home subsidy. So I said, okay, I'm at the bottom of the flats. What if I walk down to the homes of the elderly and I actually walk down the corridor and I knock on the door and I say, here's my vaccine. No, they cannot come down to the bottom because that's not home. They must be in their home. Then I said, okay, what if I walk along the corridor and auntie is in the home and she sticks her arm out and I vaccinate? Cannot, the whole arm must be in the home. And I achieve more than any bricks and mortar, because the GPs are so busy, right? I do vaccination. My role is to do vaccination. We also check your diabetes and high blood pressure. So this is the latest for my final conversation with Ministry of Health. Dear Ministry of Health, thank you very much. I love you for providing vaccination subsidies for flu. However, you still haven't given me a straight answer for what is mass, number, what is home, arm in, arm out, body out. Okay lah, never mind. I akan datang right to Minister for Health and ask him for clarification. In the meantime, I still keep going, okay?
Thank you very much, Dr. Carol. Very interesting lecture. My question is actually more on the practical aspect of now that you're going to have Healthier Singapore strategy policy coming out, and where the preventive healthcare is more will now be empowered with the GPs, basically the primary healthcare providers. So, what would be your communication drivers, or how do you think that we can actually sustain this vaccination drive for the older adults with this Healthier Singapore undertaken by the primary care providers?
Okay. Healthier SG, just to give the background, is a national program announced by our minister to promote healthier Singapore. We are not healthy, we are just healthier, okay? Because we have high blood pressure, diabetes, and all that. So it was centered, like in many countries, around the family physicians. But remember the 5 A's, right? Each family GP group doesn't really do outreach. So we always knew that when we do the outreach and we raise awareness, then we refer them to the GPs. But actually along the way, in my community, I'm a specialist, but in my community, I have my GP clinic equivalent. So I also have Healthier SG GP, primary care. So that's one thing. And to us, it doesn't matter as long as we achieve those numbers. As long as we achieve my target for my population, because I work in a geographical area, is 100% flu vaccine, do or die. I tell my staff that. Okay? So it's called do or die. So we do that, and yesterday they just got told do or die. But the point being, because we go house to house, so we actually can track in one block how many people actually did come back, forget it. So that's very important, set a target. So that's why I'm a bit mad about this, what is your mass number? I don't know what the hell that means, but never mind. But sustainability, very good point, is very key. Yeah, it doesn't make sense to drag them to a cardiologist to do vaccination. I work in a building full of specialist doctors. So we decided, no, it's more sustainable to go out to the community. We decided it's cheaper actually to have lay people raise awareness. My nurses, actually, I do head-to-heads with my nurses. I once did a program for osteoporosis where I head-to-head a volunteer versus a nurse for health coaching. Guess who did better? Yeah, my nurse wasn't very happy, but the volunteer did better because we use social media, we use videos, this and that. So my favorite pastime is dragging out all my farmers and say, do you have cute videos with cute aunties on infographics that you can give me so that I can play it? And that makes it easier because I have an untrained who does this thing called press play. And then the videos will start dancing, and that's the best ever. Plus the goodie bags. No, I'm just kidding. But my point being is if we want to achieve that magic number of 50%, 60%, 70%, we have to think out the box. We have to think people and not professionally how to do it. Nurses are not actually, we are so short nurses, so we use lay people now, ambassadors, vaccine ambassadors. Yeah.
I think that relates to one of the questions online is how do we find the Carol Tan in each country, or what's transferable to other countries? What's your keynote? I think you sort of answered that, but what's the key transferable message?
Well, I'm actually flying to Indonesia. I'm the classic Singaporean, born in Singapore, father from Malaysia, mother from Indonesia. So I'm actually flying to Indonesia in 2 weeks' time to see whether we can work with local partners to scale up this program. But the other thing I realized is that having a vehicle that toodles around is also very helpful because it's like visual, and bringing it to people. That means a vehicle which carries the license for a mobile clinic is. I give you no excuse lah, please lah. I come to the bottom of your flat. You tell me you want to go to the GP, okay lah. You tell me I have to take bus, okay lah. I'm right at the bottom, so I give you goodie bag as well, okay. The only person who stopped me now is the Ministry of Health between the mass number lah and the body in and out lah. So that's my major barrier now. Everything else has been sorted out already.
Thank you, Raja. A question from him.
So, wonderful talk. Love your passion, Carol. You've ticked all the boxes that I talked about in my talk, the introductory talk. You've got a mobile van, you've got passionate people, you're doing vaccination mass scale. Have you thought about clubbing other adult vaccines along with influenza, or is the focus only on influenza because of the Singapore government protocols?
Very good question. So in my initial years, when even Singapore government wasn't funding influenza vaccine, I focused on influenza. Then They didn't fund pneumococcal, so I focused on pneumococcal. So I call it first mover, come out newspaper, you know, that kind of thing. Just last week, I had a discussion because I bargained that my money that I get from private, which is one of the components, we no longer only specifically fund flu. I'm moving on to adult vaccination. Of course, I'm still struggling. Guys, you're the professionals in the field. Can you somewhere along the way change the criteria for Tdap? Diphtheria, tetanus, pertussis, right? The criteria says that it's available for Singaporeans, but you must be pregnant. I'm still hunting for a 65-year-old pregnant man in Singapore to get the subsidies.
Thank you.